Hi there, my name is Dr. Laura Trinastic, and I'm going to be talking about our primary care mental health integration rotation, just one of the many great rotations available in our psychology internship program here at the Tampa VA. I'm going to run through a couple quick facts about PCMHI if you're not familiar with it. It is a general mental health rotation in our program, but can have a health psychology focus. We'll get more into that later. The goal of PCMHI is basically to be embedded with the primary care teams to help with early identification, intervention of behavioral health conditions, and also to help identify veterans who might need more specialty mental health services, optimize those referrals, get them set up as quickly as possible with what they need. So we are co-located with those primary care or PACT teams. Each team has a PCP, RN, LPN, and then we have these ancillary team members, psychology, as well as social work, nutrition, pharmacy, peer support, all available as well to assist. So lots of opportunities for interdisciplinary work and consultation with all these different team members. As far as the setting, in Tampa, we have PAC teams in the following locations here. The one that's probably the most important is the primary care annex, located at Hidden River. The vast majority of the PAC teams within the Tampa area are located here. That's where I'm at. Also includes our Women's Center, which is the primary care clinic for our female veterans. Most of the supervisors are going to be based out of the PCA, including myself, Dr. Borst, who works in the Women's Center. So with the primary care teams right here in the clinic, our goal is providing same-day access for mental health services. We get warm handoffs from the providers, do meet and greets with new patients there. Also able to do walk-in appointments. It's a pretty fast-moving setting. Those assessments are going to be brief, about 30 minutes or so. Follow-ups are also going to be brief, consistent with the PCMHI model. If we think that veterans are not quite a good fit for that brief model of care, that's okay. We can triage them to the appropriate level of care, either outpatient mental health, any of the specialty mental health clinics that we offer here in Tampa. And of course, we do have both in-person and telehealth appointments for both those initial assessments as well as for follow-up. So we like to keep it flexible. Any veteran that's enrolled in the VA in primary care is basically fair game for us to meet with. So we could see the full spectrum of ages, young adults just out of the service, as well as all the way up to our geriatric population. We have a couple PAC teams that specialize in certain populations. Again, our female veterans in the Women's Center, our HPACT clinic, helping those veterans that are homeless or in a period of transition, and the internal medicine clinics, which usually see patients just with a higher level of complexity, and they're staffed by our medical residents. In terms of what we're going to see, it's pretty much a little bit of everything. Anxiety, depression, adjustment disorders are very common. A lot of relationship stress, PTSD. We see a lot of behavioral medicine diagnoses as well, chronic pain, substance use, that can be alcohol, tobacco use, insomnia. We also work with a lot of veterans to help manage some of those chronic medical conditions, things like diabetes and heart disease. If they're more on the mild to moderate range of symptom intensity, we're probably going to keep them here within primary care, work with them on doing some of those brief skills-focused interventions. If they're on the more moderate to severe end or have kind of more chronic conditions, like I said, we can refer them to any of our other outpatient mental health clinics. As far as supervision style, because we're right there in the bullpen, which is just a real big space that includes the primary care teams as well as the extra team members. It's just getting used to that setting. You'll be sitting right next to us for a lot of the time in that bullpen. So it allows for a lot of informal, flexible supervision opportunities. You get a nice sense for how the flow works. Also easy to have consultation with any of those extra team members or walk up to the nurse or the doctor and ask them questions. So we've got that in addition to that formal hour of supervision each week. Typically, we use the scaffolding approach, have you shadow us first, and then start taking on more of that functional assessment or doing more of like the therapy follow-ups with a goal of getting you guys independent, kind of as a functioning member of our team, taking on handoffs, and seeing follow-ups. So the expectation, what we're shooting for is about 4 to 5 patient contacts a day. That includes warm handoffs from the team, scheduled follow-ups for therapy, as well as phone contacts. We do a fair amount of that. So that can be phone meet and greets after a patient had their first primary care appointment, or kind of coordinating care, right? Coordinating follow-ups, coordinating referrals, things like that. As far as some just different training materials, we have a lot of things available. We don't offer any kind of formal EBP trainings within PCMHI, but you do have access to a lot of different types of materials. That includes the PCMHI competency training materials, in addition to tobacco use, brief interventions for pain, depression, and of course, CBTI, which is something we commonly use here. Some other things that are available. Then we have a weekly 1-hour health psychology seminar every Thursday morning where staff come in and present on different topics relevant to primary care, but of course, just health psychology in general. There are certainly opportunities to participate in other didactics, other trainings as well that might pop up, while you're on rotation. And we have providers that run a couple of different groups as well for tinnitus, sleep hygiene, CBTI. So if you're interested in sitting in or helping out, helping to facilitate some of those groups, we have some opportunities there as well. So a lot of different things to offer. It is a flexible and fun rotation. We would love to talk with you more about it and certainly work with you if you're interested in the Tampa VA. Like I said, my name is Dr. Trinastic. Dr. Borst is the other psychologist who will be available for supervising. And you can reach out to either of us here if you have any questions. Thank you, and we look forward to seeing you guys soon.